Communications task is that 3 weeks baby who is diagnosed with laryngomalacia. 1 week back, she was diagnosed as gastroesophageal reflux disease on lifestyle modifications. Now you have to talk with the mother. Support mother is Suhana. The baby is Ronnie. About information giving, that is laryngomalacia. Now you can start.
Can we wait a moment? I will prepare for that.
Okay.
Okay, doctor, I can start now.
Okay, start.
What's the name of mom? I forgot.
Mom is Suhana.
Suhana. Okay, all right. Hello, good afternoon.
Good afternoon.
I'm Dr. Teresa, one of the child doctor. I believe I'm talking to Mrs. Suhana, moms of Rooney.
Yeah.
How are you, Suhana?
Yeah, I'm fine, but a little bit worried about Ronnie's conditions.
Yeah, I can see that you have been really tiring taking care of Rooney. I'm here to see because I want to discuss about Rooney conditions. Would you like anyone to join with us today?
No, you can talk with me.
Okay, all right. Before I start, I want to ask how far do you know about Rooney condition?
I have Ronnie has some problem in his larynx. You guys are telling that it is laryngomalacia, but I want to know that is that anything? What is that?
Yeah,
Is it
that's a
something
very good
serious?
question. That's a very good question. Yeah. So I'm here because I want to explain to you about the laryngomalacias. So can I draw a pictures just to make sure that we are on the same page, right? So in
Okay,
our
okay, yes.
body,
Mm-hmm.
there is a one just above the there's a vice box. We call this as a larynx.
Mm.
And what happened to the Roni condition is that this vice box has been very soft and floppy. So whenever the Roonies take a breath, these box has been soft and floppy, so it temporarily blocked the baby's airway. Are you with me so far?
Yeah, I'm with you. So,
Sure.
yeah. So why? Because what is the treatment? Why it's developed? Like, what is the treatment for that?
Yeah, I can understand you might have so many questions. So we don't know we're not quite sure why is the cause of this problem. Sometimes it can happen out of no reasons. um but there is a good thing is that the child of these problems can goes child can goes over with these problems at 1 years of their age, when
Mm-hmm.
their bones or when their soft bones become developed, these conditions can goes away. So we don't actually need any treatments until or unless it causes serious symptoms to the child. We can wait until the baby is first years of her age.
Okay, okay, I understand. So, doctor, you don't want to any test because of this
What do you mean by test? We are gonna
investigation.
yeah, sure. So we are gonna do the test, that is the camera test, just to see whether there is actually a floppy vice box here or not. So one of the tubes will go from the Rooney mouth and then down, and then camera will detect whether there is actually the problems in that vice box or not. These will be done by the ear, nose, and throat specialist doctor.
Okay, I understand, doctor. But doctor, 1 week back I was on your hospitals and my child has some GERD, like gastroesophageal reflux disease, you told me, and you have not given any medication. I don't know why you are doing all that. What is the medication of GERD?
I'm really sorry that this happened, but let me ask, um, how is Rooney now? Is Rooney's GERD has been under control without any medication?
You have not given any medications about GERD. So what is the treatment of GERD?
So sometimes this baby with this soft voice box, they have a problems with the reflex of the acids back to their food pipe. So normally, what we normally do is that we just make some lifestyle changes. We give the, we ask the parent to give the foods with the food thickeners, and then ask, and then if the condition is not improving, then we can give them medicines to help with this reflex, especially if there is associated with any breathing problems together.
Okay, I understand that. So you are not giving any treatment, anything
At the
for.
moment, what I'm suggesting is that since Rooney's has these noisy breathings, only doing the doing crying or sleeping, so the feeding, does not have any obvious symptoms of the serious airway blockage. So there isn't any problem with feeding, or there isn't any problem with the weight gains or weight loss. So we can wait until 1 years. However, if your GERD symptoms, the reflex as being serious, causing the terrible problem that can reduce the oxygen levels of the baby, then we will consider check-ins. We will consider having another meetings for further managements.
Okay, doctor. Okay.
Any more questions do you have for me?
No, I have no any question.
All right. At the moment, for the acid reflux, I'm going to give the Rooney anti-reflux medications, and I'm going to arrange a meeting with the ear and nose specialist for the confirmatory test called the camera test. They will do the camera test, and they will also give you the updated management plan for the Rooney at the times. How does that sound to you?
Yeah. Okay.
All right, that's great. So, just to make sure that I have given you the clear instructions, can I summarize what I have explained to you so far?
Yeah.
So, I have explained to you that Rooney has a condition called Laryngomalacia, which is the soft and the floppy part of the voice box. It can cause a problems with the breathings, and the child can present with the noisy breathing, especially during feedings or crying or sleeping. They can also present with the acid reflux. And right now, Runis has this problem, so we are going to give anti-reflux medications. And I'm going to arrange a meetings with the ear doctors for the further test, camera test. I'm going to give
Okay.
you leaflet and website at the same time so that you can have a read. And if you, whenever you have a confusion, you can come and see me again.
Okay. Thank
Thank
you.
you so much for your time.
Okay. So you have done it nicely, but one thing for GERD, the treatment is there's something to thicken formula feed and drug to
Mhm.
decrease the activity in the stomach. And you have not again forget to give the red flags. Like if
Mhm.
you notice change in noisy breathing, change in color, okay,
Mhm.
pulling of the skin out and between the ribs, then you seek medical advice immediately. Like change in
Okay.
color, that is blue color, anything, and a
Mm.
change in noisy breathing, pulling of skin in and out between the ribs. That is maybe
Okay.
subcostal intercostal retraction tailing.
All
Okay, now
right.
I'm telling how can we do the laryngomalacia. So first IRCAP, that is intro, repo, clarify my rule, agenda, and the permissions. Actually, by examining Roddy, we found that he has a condition called laryngomalacia or soft larynx. Did you hear about that? No, I don't know. Is it serious something? Okay. It is not serious condition. Let me explain for you everything to be clear for you. Please follow me at this drawing. Okay, doctor. This is our box of the voice. It is present here in our neck. I just pointing my neck. There are two cords in front of this box. When the air passes between the cords, it produces the sound we are using to speak, or the baby is using to cry, and later on to verbalize. Are you with me? Okay, because Ronnie has soft larynx like this picture. It is very, very soft and floppy, adding the tissue above the larynx. When he take a breath in, these tissues are sucked into towards the opening of the voice box, narrowing it, producing this louder voice you hear. So how can we treat that? Luckily, no treatment is needed. 70% will improve in the first year of life and 90% will improve by the second year. So you told me 1 year, this first year it will go away. Okay. The answer will be like 70%, 70% will improve in the first year and 90% will improve by the second year. So
Mhm.
he did not get any test. I told you that no treatment, get any test. Actually, this condition is only a clinical diagnosis, and also we will have a meeting with ear, nose, and throat doctor, and he can do some tests to confirm the diagnosis. Doctor, you are kidding me. We are here, and you will not give any medications for this throwing up GERD. 1 week back. Now you are telling me that no medication as well. Actually, when he came only with the throwing up, he did not need any medicines. But now, as we said, we have to manage and treat the throwing up as it may worsen this softened larynx. Are you with me? So, what is the treatment? There is something to thicken the formula and drug to decrease the activity of the stomach. Now, what is the treatment? Soft larynx. Of only if there is any noisy breathing, change in color, pulling of the skin in and out between the ribs. At this time, you have to seek medical advice immediately. So my family told me that why you are not doing anything for him. We'll definitely give you some trusted website and some leaflets about this condition. And if there is any questions from you and your family, you always can come to us. Okay. So this is all about.
All